Senator Coleman.
Thank you very much, Mr. Chair. Members of the public, Mr. Chair, members of the committee, I'd like to start by thanking you for the opportunity to discuss this bill today. Since the year 2000, there have been 41 cases of illegally abandoned newborns and 34 infant abandonment deaths in Colorado. 10 of these deaths have occurred since 2016. This bill is one of the significant steps Colorado can take to prevent avoidable infant abandonment and death. Installing newborn safety devices in authorized facilities like fire stations offers a crucial avenue for birth for parents to safely and anonymously relinquish their newborn baby. The bill authorizes a fire station, hospital, community clinic, emergency center, and other authorized facilities to install a newborn safety device on its premises for parents who voluntarily relinquish their child who is 72 hours old or younger. These safety devices will not be mandatory. However, they will offer an additional safe surrender point to parents. Safety devices will not be the fiscal responsibility of the fire department or district, as monies are typically raised through community donations. Due to this, there is no fiscal note associated with the bill. Since Colorado's safe haven law went into effect, 74 newborn babies have been safely surrendered. In the future, we want to ensure the safety, and I am proud to have the support of organizations such as the Colorado Catholic Conference and others, and that list continues to grow. Members of the community are here today to provide testimony, and we are also available to answer any questions you may have. And I just wanted to go on the mic to share, and I share with committee and folks in the audience that I'm going to pass this continuing of this policy in the hearing into the more than capable hands of my colleague, Senator Smallwood. I now must go chair another committee with other policies, but I wanted to make sure I came and shared my support of the bill, and thank you for the opportunity to share.
Thank you, Senator Coleman. Do you want to be called back up for the vote, or are you good?
I'm sure that I will be in committee for a while, so I unfortunately probably won't be here for the vote, but thank you for asking.
Thank you, Senator Coleman. Senator Smallwood.
Thank you, Mr. Chair, members of the committee. Thank you for hearing Senate Bill 83 today. I can't overemphasize the support that Senator Coleman, Representatives both Luck and Bacon have provided during this process. When you first hear about a newborn safety device, right away everybody's kind of radar goes up like this sounds unusual. Tell me more. Want to again give a shout out to the three of them, the leadership that they provided through this, and to reemphasize two things that Senator Coleman stated. One, all Senate Bill 83 does is make newborn safety devices legal in the state of Colorado. That's first and foremost. Right now, and I'll briefly describe why, a newborn safety device is not something that's permitted within our current statutes. So that's number one. Number two is that this in no way requires, mandates, or candidly even encourages, in my opinion, a fire station, a hospital, or a freestanding emergency room to install one of these devices. So this law, if passed, would simply allow these to exist and be used in our state. So again, those are the two important pieces. Our current statute, which obviously we've been involved in a number of changes over the last few years, requires that in order for a newborn within 72 hours to be legally relinquished, current statute says that you have to hand that baby physically to an employee of a hospital, a fire station, or a freestanding emergency department. And it's been amazing the conversations I've had with community members over the course of the last several months in discussing this, in that there is a certain stigma that we're trying to avoid. There's a certain amount of kind of mental anguish that we're trying to avoid wherever possible, in stating that if a mother is not comfortable physically handing their newborn baby to an employee of one of these organizations, that we would provide an alternative, again, if and only if a hospital, a fire department, or a freestanding emergency facility chooses to install one of these newborn safety devices. So the law, as you read it in the bill, just basically clearly outlines what this device needs to encompass, what the rules around it, things that people have asked, things like alarm systems, redundancy within alarm systems, daily testing of alarm systems. I think if you go through the details, you'll find virtually any concerns people had about the devices themselves hopefully have been vetted out. And I think particularly within the stakeholding, we've been effective at not making unnecessary or undue changes within the law. People have asked for things like extending the period of time for relinquishment of newborns past 72 days. So within the stakeholding process, we really did the best we could to say, no, let's not delve into any of those other topics at this point. Let's simply be permissive, allow these devices to be installed and used if and when, again, the proper channels have been gone through and one of these facilities decided to install them. So would open that up for questions. Understand there's folks testifying disappointingly on both sides of the topic today, and would ask that opposition testimony be able to go first. And I'm here to answer any questions that you may have, committee, and thank you.
Thank you, Senator Smallwood. Two things. One, we'll open it up for questions from the committee. I also want to give you the opportunity, Senator Smallwood. There was rather large amendment L001 that was passed out. I don't know if you want to maybe address that now, just with it. It seems like it's maybe substantive. So,
yeah,
Senator Smallwood.
Yeah, Mr. Chair, thank you. And committee, want to thank the drafters for catching this piece and CDPHE. As you'll recall, we in a bipartisan, bicameral, and I think unanimous way a few years ago, added freestanding emergency departments as one of the authorized facilities to be able to accept relinquished newborns. And in the drafting of Senate Bill 83, freestanding emergency departments, as they are in their newly licensed format, were not included in the original bill. So when we get to the amendment phase, I plan to introduce L001, which would properly include freestanding emergency departments, which Senator Coleman and I added in our legislation a few years back.
All right, thank you, Senator Smallwood. Does the committee have any questions for the sponsor? Senator Rich.
Thank you, Mr. Chair, and thank you, Senator Smallwood, for bringing this. The Safe Haven is such a great project. But I do have a question, and maybe it's going to be someone that testifies, because they keep talking about these boxes, and that has that stigma of, you don't care any more about this child than just putting it in a box. So is someone going to explain to us exactly what one of these newborn safety devices look like?
Senator Smallwood.
Thank you, Mr. Chair, and thank you, Senator Rich, for the question. It feels like I've been answering that question for about the last 60 or 90 days. And yes, I would also, I think it's probably best to handle it in testimony, but because the bill does specifically identify everything that this newborn safety device does need to include, including the safeguards, which I think is the question that was posed to me most frequently, including by members of my own family. I would encourage you to start on page 2 at the very bottom, line 23, and go through page 3. The first couple pieces will definitely discuss that, and in the meantime, I'll be able to text you some photos of some of the existing newborn safety devices that are in use currently across the United States.
Any further questions for the sponsor? Senator Will. Is your mic on, sir? I'm having a hard time hearing. I apologize.
Thank you. Is that better?
Yes, sir.
Thank you for being here. But my question is, so there is an alarm in these, so it's, 30 seconds after the baby's dropped off, someone's notified? And then how does that, say in the rural or frontier counties that had one of these, how is that addressed?
Senator Smallwood.
Thank you, Mr. Chair, and thank you, Senator Will, for the question. So, first of all, to be completely frank, I am not sure that rural, frontier, or resort Colorado is a obvious location selection for a newborn safety device. The reason being would be the requirements of the bill state that somebody needs to be manning such a device. And I know that I have spoken to at least one representative of Fire Protection District who just stated, you know, in our area, this isn't practical. And my response was, that's fine. There's, again, no demand, no expectation, no strong arming, no browbeating that says you can or should install one of these devices. So I think in certain areas, metropolitan Denver, for example, it makes a lot of sense. In some areas, it's simply not going to make sense. Regarding your question on the alarm system, on page 3 of the introduced bill, line 6, in order to be defined as a newborn safety device in our state, the device has to be equipped with a dual alarm system, and the facility is not only responsible for the cost, but the maintenance of that system, including the alarms, so much so that they would ensure that that dual alarm system is in working order by testing that system at least once every week, visually inspecting the dual alarm system at least twice per day. So there are a lot of expectations. So back to your point about rural frontier resort Colorado, if a facility feels they just don't, they just don't want to for no reason, or specifically they don't feel like they can monitor the alarm system twice a day, actually test it once a week, then it leads back to your first question. It's probably not a good place to have a newborn safety device.
Any further questions for the sponsor? Seeing none, I will take this opportunity. If you are here in person and you wish to testify on any of the bills before us today, Senate Bill 83, 73, or 77, and you haven't done so already, please go sign up over here on my left side on the table over there. There is a QR code as well. Senator Smallwood, we do have a number opposed, and you also have a number that are for the bill. Do you have any preference on what goes first?
Thank you, Mr. Chair. I would ask that opposition goes first, please.
Perfect. Thank you. We have Lauren Smith in person, Richard Erlab, Mar Galvez Seminario. If you want to come up to the dais, and then online, if we can pull up Dr. Patrice Martin. We'll start off here in person on my left, ma'am. If you want to go first, just state your name, who you represent, and you'll have 3 minutes to testify. Start whenever you're ready.
All right. Thank you, Chair, and thank you, members of the committee. My name is Lauren Smith, and I'm the Black Civic Engagement and Policy Manager for Soul to Soul Sisters and Elephant Circle. Today I'm testifying on behalf of both organizations in opposition of Senate Bill 83. Soul to Soul Sisters and Elephant Circle are reproductive justice organizations, and we advocate for people in the perinatal period, especially Black and Indigenous birthing people. And we seek to ensure that people have all options when it comes to their pregnancy, including deciding how and where to give birth or making the decision to end the pregnancy. We know the decision to relinquish a newborn is not one that any person takes lightly. The circumstances that may lead to this decision are varied and complex, but we know that in every situation, this person needs support in that moment. These newborn safety devices create no opportunity to ensure that the support is provided. It's a solution centered around this idea that the newborn can be saved from their parent and ignores the physiology of the birthing newborn dyad and the root causes that may lead to a person relinquishing their newborn. So this policy really is something that is touted as a simple solution to something that's actually extremely complex and neglects to address more enduring and transformative solutions. We recognize this bill seeks to find a solution to a problem in which people are fearing shame or stigma when relinquishing their child, or perhaps are afraid that they may be reported to CPS upon relinquishment. But the solution here is not to have these anonymous drop boxes free from interaction from others. In fact, it's the opposite. We really feel that in these moments, connection is going to be the most powerful form of intervention to support the family. It would be better to reform our mandatory reporting laws to ensure that people interacting with parents in this position can really support them without risking that harmful system intervention, which also comes with that shame and stigma. And we know that this is a risk that intervention is greater for Black families, poor families, and other families of color. Additionally, addressing the root of this issue also looks like making sure that we're protecting and expanding access to abortion so that pregnant people who are unable to give birth and care for a child are able to access and afford abortion care in a timely manner. We're really concerned about the direct connection between the foundations of these baby boxes and the anti-abortion movement. And we are seeing a wave of these policies across the country pushed by anti-abortion proponents as an alternative to abortion in the post-Dobbs world. So to be clear, these boxes, we don't see them as a humane alternative to abortion or a response to families in crisis. So for these reasons, we ask that you please vote no today. Thank you.
Thank you, Ms. Smith. Ma'am, if you just want to introduce yourself, state who you represent, and you'll have 3 minutes to testify. Start whenever you're ready.
Dear members of the committee, my name is Mar Galvez Seminario. I'm the Legislative and Research Manager at the Colorado Organization for Latina Opportunity and Reproductive Rights, or COLOR. We are a reproductive justice organization that works to engage and empower Latinas in the state to speak out about the policies that impact our daily lives. I'm here to testify in opposition of Senate Bill 83, which would authorize a fire station, hospital, community clinic, emergency center to have a baby box for parents who voluntarily relinquish their child 24. I'm going to skip this part. These baby boxes are a project led by the anti-abortion movement, largely framed as an alternative to abortion and in response to Roe's repeal. These devices are popping up all around the country, and while it was largely rare before, it is a sign that people are increasingly forced into pregnancy and childbirth. Millions of dollars have been invested into these expensive devices, and baby box funds could have financed accessible birth control and childcare so that the parents could take care of their babies, find employment, and become self-sufficient. The bill attempts to create a solution that is completely centered around the baby and ignores the fact and the support and resources the person relinquishing the child might need. It also encourages a future where abandonment of newborns is the norm and somehow better alternative to safe and accessible abortion. Adoption, or in this case, relinquishing the child, would be the alternative to parenting. Abortion is the alternative to being pregnant and giving birth. This project, led by the anti-abortion movement, still ignores our human right to bodily autonomy. As a Latino-led reproductive justice organization, we're also aware that the bill, that the disproportionate criminalization of women and people of color, even if this bill does not explicitly criminalize people in desperate situations, it increases and perpetuates new systems of surveillance. The fear that the alarm might bring shame, attention, and the police to them is not supportive, safe, especially for women of color. Reproductive justice centers self-determination. This movement does not come from the desire to help newborns, but the need to further stigmatize and do away with our fundamental right to an abortion. I ask you to vote no. Thank you.
Thank you, Ms. Galvez Seminario. Sir, if you just want to introduce yourself, state who you represent, you'll have 3 minutes to testify. Start whenever you're ready.
Thank you. And thank you for this opportunity to testify, members of the committee. My name is Rich Erlob. I serve as president of the Adoption Search Resource Connection and the Coalition for Truth and Transparency in Adoption. We are here in sympathy with the emotion and the sentiment behind the bill. We are here in opposition to the effect of the bill and believe that it is unnecessary because we've already addressed the issue with the existing law. I've facilitated search and support groups for adoptees for 25 years, and I've seen the damaging, even deadly effects of severing people from their roots with no information. Like many bills, this one comes with good intentions. Some are unverifiable and short-sighted assumptions and potentially significant negative long-term unintended consequences. There are things we do know and don't know about this, and much about this bill comes from a void of information, which is another reason we oppose it. Life's 3 biggest questions are, where did I come from? Why am I here? And where am I going? What we do know is the safe haven community is divided about whether or not baby boxes are a good idea. We do know that there are tragic, heartbreaking stories from both proponents and opponents of the bill. I have seen people suffer from incredible addiction up to the point of suicide in our own group because they have been severed from their roots with no hope. Colorado currently has over 900 safe haven locations where a baby can be dropped off anonymously with no questions asked. This is more than double the number of Walmarts and Starbucks combined, and almost as many as there are marijuana dispensaries. This is more than adequate to address the issue. The numbers are small, thankfully, but each story is important. 74 infants have been left at these locations since 2001, averaging 3 to 4 per year. Addiction and suicide rates among adoptees are higher, up to 4 times as high than for those who are not adopted. Mothers who killed their newborns fit a consistent pattern, now considered a syndrome of severe denial and passivity, according to Santa Clara University law professor Michelle Oberman, author of 2 books on the subject, and I have a related article if anyone is interested. Relinquishment and separation from a mother creates trauma for the infant and can affect brain development. Baby boxes date back to the 12th century when a pope ordered churches to make them available. Today we know things about attachment theory, early life brain trauma, human development, and identity formation, and we can do better than 12th century thinking. You have letters from a number of people from various professions having problems with the language of the bill, and the bill's language is in conflict with longstanding principles and requirements for relinquishment found in Title 19. I respectfully ask for your no vote and welcome any questions.
Thank you, Mr. Erlub. Next up online, if we can pull Dr. Martin, if you want to unmute yourself, state who you represent, and you'll have 3 minutes to testify. Start whenever you're ready.
Hello. Can you all hear me?
We can, Dr. Martin. Seems to be breaking up just a little bit.
Hello?
Can you hear us, Dr. Martin?
Yes, I can hear you. Can you hear me?
Yeah, your connection seems to be low. You might want to try to turn off your camera, and that could maybe help with the connection. It just seems a little choppy. Feel free to start whenever you're ready. You'll have 3 minutes to testify.
Okay, can you all hear me?
Yes.
Okay. Hello. Dear members of the Colorado State Health and Services Committee, my name is Dr. Patrice Martin, and I come to you as an independent citizen of the United States of America, and I'm here today because I deeply care about children of this nation and the great state of Colorado. In October of 1976, I was abandoned at birth. At that time, my birth mother already had 1 child. My sister, who was 2 at the time. She began a relationship with a man at work. She was a nurse and RN in a hospital in Pittsburgh, Pennsylvania, and she was just starting out in her career. Not making much, she had the shifts at the hospital that no one wanted. My mother lived in an apartment in her uncle's house and also was taking care of her mother financially, and her parents were really proud of their daughter at becoming an RN. She had already had 1 child by a man she was not in a relationship with, and she had hopes for a new career that was hopefully turn her economic situation into something better. But she was in a crisis. When it came time for her to deliver the child that she was secretly carrying, she asked if she could have a time off, and she was denied. So in that apartment, she delivered me on the bathroom floor of that apartment and cut the cord. And then she took me to a box in a dumpster area and put my sister's clothes on me, took me to a dumpster area in a mall not too far from her house, and then subsequently anonymously called the police and reported that there was a child abandoned behind a mall. After being reunited with her and hearing her story, I know personally that she did not do this methodically or rationally. She did this because she was in a mental health crisis. One example of many stories of women and even friends who have had crisis pregnancies that I have heard over the years. I stand here in opposition to SB083. Why I'm here, number one, as it has been said, it promotes diminished outcomes for birth mothers. In 2007, an article by Henny et al. entitled Evolution and Revolution, Birth Mothers Experience, talked about how there's grief and loss for these mothers. And, you know, over time, there are lifelong implications for women who very much abandon their children, and we should not be promoting laws that would continue that. I also come and stand to you before as a member of the adoptee community, and also very much concur with what my brother has said in the adoptee community around the effects of this. Please I stand in opposition to this, and I hope that we will be heard. Leaving a child in a box based on research, even for 2 minutes, does not work, and only promotes PTSD.
Thank you for your testimony. Thank you for sharing your story, Dr. Martin. Does the committee have any questions for these witnesses? Senator Fields.
Mr. Chair, and I really appreciate your testimony and your position on the bill. And I was wondering if you can describe a little bit more about why you don't think that this bill would be effective as it relates to women who are trying to make that decision. I believe that we already have very strong safe haven laws on the books. And just the concept of, you know, putting a baby in the box is just, I'm not quite sure that's the best approach. I wasn't here for all of the testimony, but I was wondering if you can help me understand a little bit more about why you would oppose this bill.
Ms. Smith.
Yes, thank you. So we see that the baby boxes and additionally the Safe Haven program is only really partially effective in addressing what we see as a very complex issue. You know, in this moment when this parent decides to relinquish their newborn, we know that this is a moment when the whole family is really needing support. And as I've forgotten your name, I'm sorry. Richard here has named too, this is a really crucial time for the dyad of the parent and the newborn, and it's something that will impact the newborn's development likely for the rest of their lives. So we just really feel that we should be directing attention towards unequal social and economic support available to families that are getting to this moment where they are relinquishing their newborn, rather than putting more energy into a policy like this, which we've seen has varied effects. I can also speak to the Safe Haven law's effect as it, you know, is in relation to this. We know from CDHS that only a very small handful of infants are relinquished every year. In 2022, the most recent data, we know that the program was used twice. So I think we're just thinking about more complex solutions than this would be really valuable.
Do we have any further questions? Mr. Earlham.
I want to call you Madam Chair, but I guess you're not Madam Chair right now. Thank you.
Thank you.
I've had conversations with numerous birth mothers who were in similar desperate situations, and unanimously they say that really what they needed was support, not a faster way to be severed from their child. According to the research done by the professor from Santa Clara University, she's written 2 books on it, and she has concluded that there's actually a very consistent psychological profile among women who do tend to commit neonaticide. I'm not sure I'm saying that correctly. And they are in a severe form of denial, and they are suffering from extreme passivity. And what we've seen, even though there have been 20 years of safe havens, the numbers have not really changed in terms of infanticide, and even here in Colorado in terms of the number of children who are tragically left in very dangerous situations or murdered. And so there seems to be a disconnect between what we're trying to accomplish in saving lives and the actual needs of the person. And her recommendation is that the mother in crisis needs a friend or a relative to kind of take charge and give them the impetus to seek help, rather than severing them from an opportunity for that help. These people could be victims of incest. They could be forced into a situation by a pimp. They could be have a violent partner. This is a very, very traumatic thing, and offering the opportunity to deposit someone in a box and then walk away does not imply that that person is going to be healthy or well in any way, shape, or form.
Mr. Chair, I have a follow-up.
Yeah, Senator Fields.
And I've been somewhat offended by some comments regarding thinking that these baby boxes is an option in reference to maybe someone disposing a child or a baby in other means. And, I just don't know if you have a response to that, because for me, that's just, if people are going to do those kinds of things, they're going to most likely do it. But I don't know if that is justification as an option to have these boxes. So what would you say to lawmakers here today that says that this is a better option to put a baby in boxes versus, compared to what I'm hearing, it's better than discarding a baby?
Mr. Erleb.
Thank you, Mr. Chair. And thank you so much for that question. I think that in the case of a crisis or a tragedy like this, we want to do something. We want to feel like we're taking action to reduce the chances of this happening, and that's very understandable. The problem is that this whole policy, this whole cottage industry that's being built is really coming from a void of information. If there are no names given and no questions asked, we don't know who it is that's leaving these babies at safe havens or who's leaving the babies at the boxes. We don't know if it is their intent to harm the child. We don't know if they might be an undocumented immigrant. We just don't know. And so there's an assumption that is driven by legitimate concern, but all the data that we've been able to gather says there's a huge disconnect between that assumption and the solution. Does that help answer your question?
I was just wanted to get some input on your the rationale and why I'm hearing this would be good policy.
Ms. Galvez Seminario.
From Calor's perspective, we see this as a movement hoping to normalize the relinquishment of a child as the safe, quote unquote, alternative to an abortion rather than the safe alternative to other types of relinquishment of a child, say in unsafe places. And so by normalizing and making this more available to people, we fear that it'll become the normal, quote unquote, alternative to abortion rather than a way to make this safer for folks.
Ms. Smith.
I just want to also add that I think, there's a few things we hear when you name these specific circumstances where someone has to leave their baby wherever and not in this safe box. We know that there's circumstances that lead to this, and we need to be looking at what the root causes of these circumstances are. I think looking at Indiana, who was one of the first states that passed this baby box law, is a good example. 19% of single mothers in Indiana live in poverty, and about half of pregnancies in that state are unwanted or unplanned. And so to Mara's point, this is something that's being named as a simple solution when there's a lot of complexity around making sure that people have full range to reproductive health care options. And it was also named that another reason someone may not bring the child right now under certain safe haven laws because of that fear of shame or stigma. A lot of that comes from the very real potential consequences of system intervention that can be very harmful to that person and their family. And so we want to make sure that they are actually able to interact and connect with people in these moments. And we just don't feel that the baby boxes is the way that will do that. In fact, will move us away from normalizing connection during this moment of crisis.
Dr. Martin.
Yes. Thank you. I just wanted to say that I agree with all that has been said. And I just wanted to harp on the fact that children do not get abandoned alone. They get abandoned because of a mother that is in crises. So my thought process on this is really looking at what needs to be done to support mothers in crises before it gets this far. My particular situation, my mother was in crisis and she couldn't take off work. So funding more supports around childcare efforts, funding more supports around support for mothers that feel like they're in a crisis, feel like they're having a mental health crises in that area really would help. You want to proactively get at this before you have to use the alternative of a box. It's children and when mothers in crises are inextricably linked. So you have to look at that. Boxes do not solve this problem.
Senator Rich.
Thank you, Mr. Chair. And I hope I get your name right. Maura? Mara? Okay. Well, you brought up something that I wanted to ask you about, and it was about you don't want this to normalize. But are you saying that you want to normalize abortion?
Ms. Galvez Seminario.
I think, especially from a reproductive justice perspective, everybody has the right to make decisions about their own bodies and their own lives. And what I was saying is that this would normalize the baby boxes as an alternative to abortion.
Senator Rich.
Thank you, Mr. Chair. So are you against the safe haven law overall?
Ms. Galvez Seminario.
No, ma'am.
Okay. Thank you.
Any further questions for these witnesses? Seeing none, thank you so much for being here. Next up in person, we have Dr. Thomas Perrell, Kelly Bernatow, Alyssa Hirsch, and Haley Burke. Do we have Dr. Thomas Perrell in the room? Not seeing him. Let's call up, is Sarah Wagner in the room? We're going to start off on my left, ma'am. If you just want to introduce yourself, state your name, who you represent, and you'll have 3 minutes to testify. Start whenever you're ready.
Senators, thank you so much. My name is Sarah Wagner. I am the Executive Director of Colorado Safe Haven for Newborns Nonprofit. Our organization was formed in 2003.
Ms. Wagner, can you pull the mic to you a little bit?
Better?
Perfect, thank you.
Sorry about that.
No, you're fine.
Sarah Wagner, I'm the Executive Director of Colorado Safe Haven for Newborns Nonprofit. Formed in 2003, we are the nonprofit that disseminates information to the community about the Safe Haven law in Colorado. Before I start with what I had prepared to say, I wanted to reiterate what both Senator Smallwood as well as Senator Coleman stated, that there are no additional changes to the Safe Haven law as it stands. This bill would be introducing an additional option, and it would be an optional, not mandatory. There's been a growing demand from the public for newborn safety devices nationwide. Our organization has been fielding inquiries about them for over a year. Calls, emails, and social media posts from concerned citizens all wanting to know where they are located in Colorado and how a device can be placed in their city. They actually come into our organization weekly. In today's world, we live in a time where people have more digital interactions. It's a reality that cannot be ignored. When faced with crisis, many people may not feel as comfortable with a face-to-face surrender of their newborn baby. And it's not a lack of care or concern. It is truly a symptom of the age in which we live. Newborn safety devices represent a solution to this modern reality. They enhance the current Safe Haven law by providing a tangible solution, a secure, anonymous way for birth parents to ensure their baby's well-being, free from judgment or repercussion. Senator Rich, you had actually asked about what they look like. I did bring in visual aids until I found out they were not allowed, but I have them if you would like to see them later. The safety devices would be installed in some current safe haven locations. They are located on the exterior wall with retrieval only from the interior of the building. The devices are temperature controlled and have redundant safety features. Senator Will, you were asking about alarms. Once the exterior door is open, the first silent alarm is triggered inside the location and at the department's dispatch center. The second silent alarm is activated once the infant is placed in the medical bassinet, and there's a third alarm that sounds audibly 60 seconds later. So it gives that mother a chance to be able to leave the situation, to be able to still keep that anonymity. There's also an additional optional alarm that can be activated by the parent before closing the door. Once the exterior door is locked, once the exterior door is closed, it locks automatically and cannot be reopened. On average, babies spend 90 seconds in the bassinet before trained personnel or first responders retrieve the baby, conduct an initial medical assessment, and then transfer the infant to a hospital for further evaluation. It's important to recognize the safe haven law is still considered a last resort, and even then, the goal remains to facilitate a face-to-face surrender whenever possible. These devices serve as a final option for individuals in truly desperate situations. By integrating them into our safe haven law, we send a clear message that no birth parent should ever feel alone or without options. Ultimately, this is about preventing infant abandonment and death in Colorado, which sadly has happened over 40 times since 2001. Thank you so much. I urge you to consider this with compassion and foresight.
Thank you, Ms. Wagner. Ma'am, if you want to introduce yourself, state your name, who you represent, you'll have 3 minutes to testify. Start whenever you're ready.
Good morning, Senators. My name is Hallie Burke, and I will be representing myself. My name is Hallie Burke, and I am alive today thanks to the Safe Haven Law. My birth parents were unable to take care of me for an unknown reason and abandoned me at a fire station when I was 2 days old. And I was immediately taken into foster care, where I am now with my loving family today. I am 21 years old now. I have a loving father and mother, along with a younger brother and sister, whom I love very much, and are also adopted. I don't know who my biologic parents were, nor do I know who they are now. But I know that it is because of them that I am alive today, and I am able to live a normal life as well. I'm so glad to know about the Safe Haven Law because of how I am here. However, not everyone knows that this law exists, and it has led to tragic events. I believe that baby boxes will not only help save babies' lives, but also show that scared mothers and fathers that there is another way to save their child anonymously and to give them a chance at life, to be put in loving families like my own. I believe that every child should have the right to live, and believe this will significantly help them reach that goal to save even more lives. Thank you so much for listening. Let's save lives together.
Thank you, Ms. Burke, and thank you for sharing your story. Next up, ma'am, if you just want to introduce yourself, state your name, who you represent, and you'll have 3 minutes to testify. Start whenever you're ready.
Good morning, Senators. Thank you for the opportunity to present to you today. My name is Alyssa Hirsch, and I am representing myself. I am here to support the addition of newborn safety devices to the Safe Haven Law because it provides a safe, anonymous, no shame or judgment option for birth parents facing a crisis situation. My husband and I are adoptive parents to a 3.5-year-old daughter named Mary Philomena, a Safe Haven baby. Mary was born at home in a basement. Her birth mother called 2 friends asking them to take her somewhere safe. Mary made her way to a local fire station where she was safely handed to a firefighter. Police investigated and determined this to be a true Safe Haven surrender. Mary was taken to the hospital emergency room, where she peacefully slept in a warm crib surrounded by firefighters, police, doctors, nurses, all wondering what would become of this sweet, perfect new life. 15 hours after Mary's birth, my husband and I received a text message. It said, "This is the foster care team. We need placement for a Safe Haven newborn girl. I'll let you Google." There was no need to Google. We knew what the Safe Haven Law was, and we were shocked and thrilled that we had been chosen to care for this baby. We named our daughter Mary Philomena. Mary, because the name means a child wanted and beloved. Philomena means friend of strength, loved, and daughter of light. It is such an honor and a blessing to be Mary's mama, and I know her daddy feels the same way. We think of Mary's birth parents often. Our love for them is deep, and we are forever grateful for them wherever they are, and we hope that they find the peace and the love and the support that they need. Mary is pure joy and a sweet blessing to all who know her. From the moment she was surrendered, she has drawn people near her to listen, to adore, to make them smile. We hope her life and story continues to reflect the love and strength and brings more light to the beauty and goodness that comes from difficult and complicated places. Our Mary is here today because of the safe haven law, because her birth mother wanted her to go somewhere safe. The addition of newborn safety devices would continue to provide protection for the baby and allow for complete anonymity and respect of confidentiality for birth parents. I strongly ask you to consider the implementation of newborn safety devices to the safe haven law. I truly believe it can save more babies' lives like Mary. Thank you for your time today.
Thank you, Ms. Hirsch, and thank you for sharing your story and your love for Mary. It was very nice to hear. Ma'am, if you just want to introduce yourself, state your name, who you represent, you'll have 3 minutes to testify. Start whenever you're ready.
Thank you. Good morning, Senators. Thanks for the privilege of your time this morning. My name is Kelly Bernardo, and I'm a women's health nurse practitioner at UC Health's Poudre Valley Hospital in Fort Collins. I personally have, within the past 15 months, had the privilege of being involved in 2 safe haven surrenders that occurred within my healthcare organization. Both of these encounters unfolded very differently. However, thankfully, both had beautiful outcomes. The first was a young teen mother to whom English was not her first language and who had been raped by a male family member, resulting in her pregnancy. I was able to meet with this mom while still pregnant and helped her to execute her plan to move forward with her decision to pursue the safe haven law for her unborn baby, all the while allowing her to have a safe in-hospital delivery while continuing to maintain her anonymity. This particular scenario allowed this young mother to be given choices surrounding her baby's well-being and ultimate placement. This mother also desired to, and ultimately did, provide a letter of health and heritage to the foster to adopt mother. Foster to adopt mother was able to present to the hospital at Day of Life 2 to meet and begin to care for the infant upon the biological mom's discharge, and strategically planned there was never an in-person exchange or meeting of the 2 parties. In the second case, the mother, another teen, had delivered at home, and her boyfriend, the father of the infant, presented to the emergency room to safely relinquish the infant. Deer in headlights, this teen father, holding his infant wrapped in a bundle of towels, had the courage to mutter to the front desk ER staff, "We can't do this." Much to our dismay, we were astounded by this teen father's story of how he YouTubed how to clamp a cord and had the wherewithal to utilize a shoelace to tie off the umbilical cord after delivery. We assured him there would be no prosecution and encouraged him to bring his girlfriend in for medical evaluation, and much to staff's surprise, this teen mom did present several hours later for evaluation. She was able to be admitted under a Jane Doe, had a postpartum evaluation, received education and resources, and was able to be discharged safely several hours later. This infant was placed with an adoptive family and is thriving. These 2 cases signify and demonstrate the courage of individuals who had awareness of the safe haven law and were willing to chance the execution of it. The 2 case scenarios presented here today, however, are unfortunately not the norm. As a healthcare professional, I feel that the newborn safety devices are a necessary enhancement to the safe haven law. I feel they will help to minimize the stigma, the judgment, the fear that ultimately may foreshadow the parent's decision to potentially utilize the safe haven law to safely surrender their newborn. The devices would provide that safe method for surrender in situations unlike the 2 remarkable ones I just detailed, where the parents do not feel the courage to embark on a face-to-face interaction with a healthcare provider. The newborn safety devices would also be an opportunity to provide education and community resource connections for the parents that they otherwise would not have had available without a face-to-face encounter. Ultimately, we would also see a decrease in maternal and infant mortality circumstances with the statewide implementation of newborn safety devices to enhance the safe haven law in all its entities. The 2 brief stories I shared here are just a sampling among many, and your support of the newborn safety devices can help create more of these heartwarming stories in the face of our safe haven law. Thank you so much for your time today.
Thank you, Ms. Bernardo.
Bernardo, yeah.
Bernardo. Is there any questions from the committee for this panel of witnesses? Senator Fields.
Thank you, Mr. Chair. I'm not quite sure if this is a question, more of a comment, and it's for you, Haley. Haley Burke. You know, I think it takes a lot of courage for you to share your story. And so I just want to thank you for sharing your story with us. And I could see that it's emotional when someone, you know, experience what you have. But what I'm hearing from the witnesses today is that each of you are describing situations that for safe haven for babies where you were rendered to a person and not a safety device or a box or whatever it is. You were surrendered to a person that took the next measures to ensure your personal safety. And so when I see you here today, I'm so glad that we have these safe haven laws where you're not being relinquished in a box, that it was given to an adult where they can determine whatever next steps needs to take place. So I was wondering if you could just elaborate a little bit more in reference to your thoughts on, and I know this is personal, you do not have to answer this question, but you've been here today just to show the value of what it's like. It changed the whole course of your life because you were handed over to an adult versus being put in a box, a device, a safety device. Can you speak on that?
Ms. Burke.
Yes, I can. Thank you so much for the question. I honestly don't really know a lot about baby boxes, but I do know for a fact that at the end of the day, all we're talking about is what are the ways that we can save lives. Because I do know that my parents were obviously very scared when they abandoned me. And I'm sure that the last thing on their mind was, we have this child, we can't take care of her. Let's give her to somebody else to help her find a new home. And I think the last thing that they would have wanted was more questions. I think that a baby box would help a lot, especially coming from as a child at school, telling all these kids about how I was rescued and them not knowing a thing about it. Even going further on into high school, nobody in my classes knew about the safe haven law. So I feel like baby boxes is just another way, another sign to these mothers and fathers that there is another way without being in front of somebody else if they want to remain that anonymous, to have that opportunity.
Thank you.
Thank you, Ms. Burke. Is there any further questions for these witnesses? Ms. Wagner.
May I actually add to what Hallie had said? Okay. As far as the newborn safety devices go, on average, there are 207 newborn safety devices across the United States right now. 45 babies have been saved in these devices since 2016. On average, for all of those 45 safe surrenders, a baby is in that bassinet for 90 seconds. There is a protocol that is established between the devices themselves as well as locations that they get installed into, that infant is in that device for no more than 5 minutes maximum. And to date, that time frame has never been hit.
Thank you.
And I know you were concerned, Senator, in terms of removing that hand-to-hand surrender. It's just giving that an additional option to these parents, especially if the parents can't bring themselves to look somebody in the eye. Just as Hallie had mentioned, potentially having to answer any questions. If they're not able to bring themselves to that point, they have another option to utilize where that baby is still lovingly retrieved from that first responder.
Thank you. Is there any further questions for these witnesses? Senator Michaelson Janae.
Thank you, Mr. Chair. And I'm sorry, I don't remember your name.
Kelly.
Nurse. Kelly. I think, I was listening to your testimony and the experiences that you have, and I'm a huge fan of the safe haven law. But I was trying to think about that little boy who brought the baby in, and you were able to convince him, however delicately, to bring his girlfriend in for care. I mean, she could have died from an infection, from the shoelace, from
a blood clot,
any of the things. And my really big fear about the box is we lose all of that opportunity to get someone the care and help that they need. And I don't know what you think about that.
Ms. Bernato.
Thank you so much. I appreciate your comment and concern. I think that what the safety devices would do because again, as I mentioned, while these two cases were beautiful cases and they had positive outcomes for both the biological moms as well as the infants, that they are not the norm. I've had the beautiful privilege of being involved in both of these cases, and I'm so honored for that. But that is not the norm that happens. We have had situations where we have had infant deaths occur because of the stigma that is surrounding the safe haven law. There still is a fear out there in the community that there is going to be prosecution brought upon these parents. And I think by having these newborn safety devices, I'll second what Sarah said in that it's another alternative. It's another addition. It's an enhancement to the safe haven law. If these parents have that courage to approach somebody and have that face-to-face interaction, 100%. I think there's more work that we need to do as healthcare professionals to be educated, to be non-judgmental surrounding that, to respect that anonymity, and allow them to make that their choice. We know that's not always the case because of the fear and stigma surrounding that. I think the newborn safety devices would give us the opportunity to even potentially put, community resource materials at the box also, so that if somebody isn't ready to say, I want to have a face-to-face interaction with a healthcare provider, a fireman, a police officer, then they can then take those resources to have something to get them started. Will they act on that immediately? We don't know, right? We obviously have a lot more work to do, and that's our goal moving forward. But I think this would be a step in the right direction to help eliminate that stigma. Thank you.
Thank you. Is there any further questions for these witnesses? Seeing none, thank you so much for being here.
Thank you.
Next up, in person, we have Randy Allen. And online, if we can pull up Shannon Johnson and, is this Representative Lori Sane? Or Commissioner Lori Sane? Also, if there's anyone in person who still wishes to testify on this bill, now is the time to come up to the desk. Lori Sane on? Nope, okay. Sir, if you just want to introduce yourself, state your name, who you represent, and you'll have 3 minutes to testify. Start whenever you're ready.
Good morning, Senators. It is an honor and privilege to be in front of you today, and I thank you guys very much for the opportunity. I'm here today representing myself. My name is Randy Allen, and I'm a detective for the Douglas County Sheriff's Office. I have been a commissioned deputy with the Sheriff's Office for over 15 years, and I'm currently assigned to the Child Exploitation and Human Trafficking Unit with the Federal Bureau of Investigation. During my career, I have worked numerous child homicides, child sex assaults, and led other child-related investigations. Most recently, in 2022, I led and investigated a child homicide case which involved a 19-year-old mother. This mother made the unfathomable decision to end her child's life just minutes after giving birth, alone and in her parents' bathroom. Due to injuries this mother sustained during that delivery, including a severe tear in the wall of her uterus, this nearly ended her life as well. Through my investigations and coroner reports, I learned that this baby was full-term, healthy, and would have otherwise thrived if it was given the opportunity. I do believe she came to this decision out of sheer panic. If this mother knew without question, judgment, or penalty, She had the option to place this child into a device such as the one we are here to speak about today, and that this baby would have been safe, warm, and would have received immediate medical care. The outcome would have been different. Now, I cannot say unequivocally that the outcome of this case would have been different, but I do believe if this mom knew that there was a box available and that the response would be so quick and that baby would receive such care, it may have prevented this mother from being sentenced to 40 years in the Department of Corrections. As a detective, I feel that the newborn safety devices are a needed and necessary addition to the safe haven law. These provide a safe and legal method of surrender when these desperate parents are not comfortable with the face-to-face option. Such devices, in the furtherance of our state laws, will undoubtedly provide more options to these individuals faced with these unimaginable decisions. Thank you for your time, and I appreciate being here today.
Thank you, Mr. Allen. Ma'am, if you just want to state your name, introduce yourself, tell us who you represent, you'll have 3 minutes to testify. Start whenever you're ready.
My name is Lori Holden. I represent myself, and I'm asking for a no vote on this bill. My name is Lori Holden, and I'm an adoptive mom of 2 young adults via domestic infant adoption. I'm also the author of 2 critically acclaimed books about adoption, and since 2020 have hosted a podcast for adoptive parents. In 2018, I was nominated by Senator Michael Bennet as an angel in adoption, which was awarded to me by the Congressional Coalition of Adoption Institute. Over the past 20 years, I've learned, often the hard way, that many common assumptions that underlie adoption policy are simply not true, such as these relevant to this bill. 1, babies are not blank slates. Instead, neuroscience tells us that an infant's brain is encoding and storing every single experience, including ones of extreme disconnection. 2, biology matters. Not knowing a baby's genetic information hamstrings parents and later the adoptee who may not even know the basics around their identity. Even more urgent, not knowing any information about the baby's in utero experience, for example, exposure to alcohol or other substances, keeps adoptive parents from recognizing the need for and accessing early interventions. In either case, there are lifelong impacts for parent and child. 3, I did not rescue my children. Instead, there were up to 50 other people wishing to adopt each of them. My children would not have languished without me. I, however, may have languished without them. But adoption is supposed to be more about the needs of the child and less about the desires of the adoptive parents. 4, relinquishment and adoption are not one-moment-in-time events. Instead, they are lifelong processes that adoptees, birth parents, and yes, adoptive parents will forever be journeying, often without support because everyone thinks adoption is win-win. Members of this committee, it's easy to be short-sighted when presented with a perceived crisis like this one. Instead, good policy requires careful thought about the best way to support adopted persons and mothers in crisis in the long view, which happens to be the name of my podcast. If we truly understood how babies' brains function and what makes for secure attachment, we would not encourage anonymous and impersonal baby boxes, to your point, Senator Malika. We would encourage more connection for a vulnerable mother and her infant, not less. Baby boxes make the lifelong process of forming connection to self and others even more difficult by the disconnections inherent in such an impersonal drop-off. Current safe haven laws offer widespread, abundant locations at which a baby can be left safely and anonymously, removing the seemingly small but very important requirement for human-to-human transfer would multiply challenges and difficulties for future adoptees and their parents. I respectfully ask for your no vote on this bill and welcome any questions.
Thank you, Ms. Holden. Next up online, we have Shannon Johnson. If you want to unmute yourself, state your name, who you represent, and you'll have 3 minutes to testify. Start whenever you're ready.
Hello, my name is Shannon Johnson. I am a resident of Colorado in strong support of SB083. Honestly, with how safe haven law is in Colorado right now, we should be looking at increasing it from 72 hours to a minimum of 60 days based off the original model, but that is not why we are here. I would like to address the witnesses who have been talking about the background. I don't know who my biological father is. I don't know anything about his background other than it is a Cajun French background. I don't think that affected me too much. There are children that are being given up for adoption that the mothers are falsifying the background as far as health goes. There are women out there who do not know the fathers. I think that when people try to portray this as not knowing the background where it came from, and we need to know all this about the child, comes second to actually saving these kids. The safe haven law is an alternative for parents to surrender their child, and it might not even only be crisis. It could be that they didn't want to be a parent. And there was another comment earlier about normalizing this, and they worked for a reproductive clinic. So it's better to normalize abortion and have that basically normalize, but stigmatize women who give up their children for adoption. That sounds incredibly backwards to me. We really need to focus on the third alternative, which is adoption. And adoption also includes the safe haven laws, because if a woman is required to raise a child that she doesn't want, they don't even need to be in financial crisis to not want to raise that child. My mother was doing perfectly fine, and she didn't want to raise me. So this argument of we need to support more mothers, what about the ones who don't want to raise kids but are opposed to having an abortion? We really need to think about the bigger picture and not get hyper-focused on single incidences. And the reason why these boxes are good is some of these people don't want to hand off their child to somebody out of fear that they might get prosecuted, out of fear that somebody might recognize them. These baby boxes, and we shouldn't even call them boxes, we should call them devices, are heat censored. They're alarmed. Somebody responds to them no more than 2 minutes. And for the opposition, I just don't see how you can be against upgrading baby safety when you would rather just have them killed in the womb. Thank you so much for your time.
Okay, that's not what this bill is about. Is there any questions for these witnesses? Thank you so much for being here today. Is there anyone else in the room or online signed up to testify or who wishes to testify for this bill? We will also make one last call. Is Lori Sane online or Dr. Perrell in the room? Seeing none, the witness phase is closed. Health Committee will come back to order. Witness phase is closed. The sponsor is before us. Does the sponsor have any amendments?
I do. Thank you, Mr. Chair. I do. I move Amendment L001.
That is a proper motion. Amendment L001 was passed out to the committee. Beforehand, and the sponsor spoke to it. Do you have any other comments on it, Senator Smallwood?
I'm sorry, sir?
Any other comments on Amendment L001? I know you've spoke to the committee about it already.
Yeah, we chatted about it beforehand. I know perhaps Senator Fields wasn't here. I'm happy to explain it if folks have questions about it.
Do we have any questions on Amendment L001? None. Seeing none, is there any opposition to Amendment L001? Seeing none, Amendment L001 is adopted. Any further amendments from the sponsor? Any further amendments, Senator Smallwood? Any amendments from the committee? Seeing none, the amendment phase is closed. Senator Smallwood, do you have any closing comments?
I do, just briefly. Thank you, committee, for your attention during testimony, for your thoughtful questions on this. This topic is one that I've spent a lot of time on. And, trying to thread the needle in a really tough debate that's happening in this country right now. So, what we're discussing from my perspective is what can we do when dealing with a full-term child and a mother in crisis? What can we do? What can we all agree on when we have a full-term baby and a mother in crisis? That's what I thought about before I even ran for office. I kept notes, by the way, like campaign speeches and stuff that I kept. And I brought this up in 2016, like running for office. Where can we end a divisive and ugly debate and come together on a topic? So Senate Bill 1850 was one of my first bills with Senator Coleman on expanding freestanding emergency facilities as a potential drop-off spot under Colorado's safe haven law. Because I naively thought, hey, here's one thing that is we can all come together on. In 2018, everybody voted yes, right? 35-0 in the Senate, 65-0 in the House, expanding safe haven laws. In 2019, thought we could maybe push some information about this. And with Edie Hooten, Representative Edie Hooten, came together with a bill educating our state, students in our state on the availability of these safe haven laws. Again, knowing that we're dealing with full-term babies and mothers in crisis. 35-0 in the Senate, 65-0 in the House. Not a single no vote on either bill. So to me, this just seemed logical that this is a conversation that we're having not about everything that I feel like I heard today, not about maternal health. You know, what should we be doing when mothers feel like the choices aren't available to them? And I have a lot of sympathy. I have a lot of empathy. But that's not this bill. That's not what we're discussing. This isn't a maternal health bill. Talk about psychology of a newborn. You know, it sounds important, and I'm sure there's a lot of studies to read on a lot of things. But with this bill, we're talking about a full-term child in a bassinet for less than 5 minutes. And having spent last weekend with my dad, we had some pretty tough times, but I don't think there was ever a 5-minute period of time in my life with him that I can look back on and feel like he was irreparably damaging me. So helping full-term babies where decisions have already been made. Decisions have already been made about abortion or non-abortion, about choice or not choice. All those decisions have already been made when it comes to Senate Bill 83. This isn't about decisions any longer. This is about two things. We have a full-term baby who has been born alive. And most importantly, not most importantly, equally as importantly, we have a mother in crisis who, let's not forget, 90 days ago, colleagues, 90 days ago, a woman in my county who was 19 at the time that she murdered her live-born child was just sentenced to 40 years in prison. This happened 90 days ago. Less than a year ago, an El Paso County mother, also convicted of murdering her newborn child, sentenced to 55 years in prison. This is not just a topic about babies. This is a topic about mothers. And again, their decisions have already been made, whether or not they're going to give birth or not. That is in the past. The decision that we're now helping mothers with is, you've made this decision, and now, apparently, all too frequently, these same mothers are facing a binary choice of, do I kill this live-born child and potentially face, at least in our state, 40 to 55 years in prison? Or do we give them just one more choice? Which, let's not forget, may not even happen. In Senator Will's district. Candidly, I don't think it will happen. These will be out there. But if we can do one small thing that costs the state of Colorado $0.00, that could have potentially taken Peyton Green and allowed her to not spend her entire adult life in prison, or Amy Grace Carr, and have her not rot away for the next 55 years. If we can't help folks like that, yeah, I'd ask for your aye vote, colleagues. Thanks.
Thank you, Senator Smallwood. Is there any comments from the committee? Senator Jaquez-Lewis.
Thank you, Mr. Chair. Thank you, Senator Smallwood. I know this issue has been something that you've worked on well before I came into this building, it sounds like. And I also commend Senator Coleman for trying to work on this issue. I do have some concerns with the bill. I actually was hoping, and I'm happy to say it on the mic, I was hoping that the sponsors would consider laying the bill over for action only, because I think there could be a path forward to fix some of the concerns that we heard. But it sounds like you want to go ahead and move it today, and I totally understand that. I just can't let go of what we heard from Elephant Circle, what we heard from Soul to Soul Sisters, what we heard from Calore. These are leading women's maternal health groups in our state. So that makes me very concerned. When we use the language of relinquishing a newborn, when we have the loss of human-to-human contact, that just scares me. So unfortunately, the bill, in my opinion, is not taking enough into consideration of what we want to exemplify as a society about caring for babies with keeping human contact. And I really do admire these groups that work on frontline agencies, frontline providers for our Coloradans in our communities, all Coloradans. So I take their expertise and their testimony very seriously. And so without amendments, I apologize. I just say I can't support the policy.
Senator Smallwood.
Thank you, Mr. Chair, and thank you for those comments, Senator Jaquez-Lewis. I didn't hear any amendment suggestions from the testifiers. None were certainly ever brought to me. I've spoken with Senator Coleman virtually every day about this bill. Have you heard of any amendment suggestions?
Senator Jaquez-Lewis.
Thank you, Mr. Chair. So everyone is a little different on how we do our bills, but when I see in my bills, if I see someone has an issue with the bill, I do try to reach back out to figure out if there's some way that it can be fixable. And I've heard from these groups early on.
Senator Cutter.
Thank you, Mr. Chair. This was a really difficult bill. I just want to be clear that this is not an easy decision. I at no time didn't even consider abortion as part of the issue, to be honest with you, because you probably know I'm a very staunch pro-choice person, and if someone wants to relinquish their baby rather than have an abortion, I am 150% supportive of that. That goes to what I believe. It is an individual's choice to do what they want. So that has no play in this issue for me at all. I echo many of my colleagues, Senator Jaquez-Lewis' comments that the testimony surprised me, actually. I came in leaning towards supporting this, and the testimony from community groups that work all of the time in this space and protecting maternal health and all those things was really, really powerful to me. So I just want you to know I appreciate your work and your intentions with this, and it was not an easy decision to move to no on this today. But again, it's out of respect for the the really compelling testimony we heard from multiple members of the community. So thank you.
Any further comments? Senator Fields.
Thank you, Mr. Chair. And Senator, I really appreciate you bringing this bill and all the work that you've done as it relates to laws associated with safe haven. I think that those laws work. And I'm glad that we have them, because it does give moms and babies an opportunity to make good decisions about what they think is going on in their own personal life. So I believe that the laws that we have on the books are appropriate. I believe that they're working. And this additional option is something that I cannot support. And the reason I can't support it is because in the state of Colorado, I believe that we should be doing more proactive upstream work. And I know that you said that this bill is not about maternal health, but it is, because what we're talking about is a mom who is pregnant. And if we can be much more proactive, and we heard witnesses talk about this, and we have all kinds of programs, prenatal care, nursing visits, we have all kinds of systems in place where we can help moms and their issues that they're dealing with while they're carrying their baby. And then we also have postpartum bills and services for moms after that, because we know that there's a lot of emotions that happens after the baby. I do not like the sense of putting a baby in a box. I know we're calling it a safety device, but there's so much uncertainty in my mind in reference to putting a baby in a device that locks up that baby. What if the baby is coughing, or the baby's whatever? I know they said it's a short time frame, but I can imagine that baby being in the box, and then, I don't know if they're going to suffocate. I don't know if they're going to, if they're ill or sick. I just can't see that as being something that I would want a mom or anybody to do. You talked about murder. Someone in your district that murdered their child, and they're incarcerated, I think you said 40 years. We're not talking about, this box is not talking about murder. Murder is a part of a criminal code. And with murder, there's consequences. It's not just moms, it's anybody that commits murder. There is responsibility or accountability for murder. A child, an adult, there's consequences for that. So I'm not quite sure what the analogy is when murder and boxes. I just don't see the analogy there. So I think that we need to be prioritizing women through maternal health, and the focus should be on that. And I think that we've heard that from some of the witnesses here, and I don't think that this is not prioritizing women as it relates to their health and their well-being, as well as for that baby. So I am a no vote on this Senate Bill 83.
Senator Rich.
Thank you, Mr. Chair, and I want to thank the sponsors for bringing this bill. I've been in this room, as most everyone else has been in this room, and listened to the same testimony, and I'm coming away with something completely different. It seems to me that this is an excellent idea, and it's not even mandatory. It's only optional, but it's a way to possibly save a baby's life. And I want to commend the witness from the Colorado Safe Haven and what she had to say about this, and also the detective from Douglas County. That was very powerful. I think any time you have a chance and an option and something that's not even mandatory to save a life, I think we ought to really consider that and allow these various fire departments or police departments to take this on if it means saving a life. So I'm going to be a strong yes on this. I do appreciate all of the testimony, but I believe I might have heard something differently than what has been said here in the last few minutes of the comments.
Senator Will.
Thank you, Mr. Chair. And I also listened to the testimony, and I mean, there's no changes to the safe haven law. And I think it was Dr. Martin that spoke and said there was a child, she was left behind the mall or something, and her mother called the authorities. But maybe there was even a mention of a dumpster, but I remember left behind the mall. And this bill is just about safe surrender, and I strongly support it.
Thank you. Any further comments from the committee? I will just say thank you to Senator Smallwood and Senator Coleman for bringing this bill. Maternal health and women's health is extremely important to me. It's something that I have supported in every chance I can in my time down here at the Capitol, and something I'm going to continue to support it. I also want on the record to say that I believe a woman has a choice to do with her body whatever she chooses to do. It's a core value of mine as an individual, and it's something that I will always believe and something I will always fight for. I've struggled to make the connection with any of that with Senate Bill 83. I think that Senate Bill 83 to me is a tool in the toolbox when it comes to safe haven. And if I believed that Senate Bill 83 infringed or harmed in any way a woman's right to choose what she does or doesn't do with her body or her maternal health or anything even close to that realm, I would be a no without question. I struggle to make that connection, though, and really view this as a tool in the safe haven law, which is something I completely support as well. And so I will be a yes today. Mr. Brown, please call the roll. Actually, can we get a motion from the sponsor?
Thank you, Mr. Chair. I move Senate Bill 83 as amended to the Committee of the Whole. I've asked for an aye vote. And the consent calendar also.
Yeah. As a proper motion, Mr. Brown, please call the roll.
Senators Cutter.
Regretfully, no.
Hawkins Lewis.
Respectfully, no.
Michelson Janae.
No.
Mullica.
Yes.
Rich.
Yes.
Smallwood.
Aye.
Will.
Aye.
Janal.
Aye.
Madam Chair Fields.
No.
And that passes 5-4.